The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, welcome to Dr. Tom Roselle Live, Asia's Health. We're ready to rock and roll and give you a little insight into your pain patterns, things that you shouldn't ignore, because if you do, you're going to get yourself in trouble. We're going to give you kind of a tip on, what's real and what isn't real, but that's going to roll into a program that we're doing at the Roselle Center in Fairfax. So those of you who are in the area, make sure you join us on the 16th of this month of April, and we're going to have some interesting did you know that type of situations, and what's something that you're doing that may be potentiating a very serious problem, and what things that you can take care of yourself. And that's the most important thing. If you have the tools to be able to take care of what's necessary, then you don't have to go on the oxycodons. You don't have to go on all the strong narcotics, because there's a solution, there's a resolution to your pain. So we're going to talk about the types of pain that you can't ignore, that if you do ignore them, you could be in real trouble. And so pay attention and do a checklist and see what you think. And as always, send me a note if you have any questions. Happy to respond to you and let you know. But if you want hands-on and really get the how-to situation, then join us on the 16th, and you're invited to be there to ask in-depth questions, and I'll be there to really open that door for you. There's a lot of different types of body pain that are very ambiguous, if you will, and we want you to know which ones you can ignore, which one you can't ignore. But you don't want to ignore pain. Why? Because pain takes away the essence of your life. If you're hurting all the time, you can't do anything. So let's get into it a little bit. When you have body pain, any kind of body pain, it's never okay, because it shuts you down. You can't function. You don't want to do the things that you normally should be able to do. And so when that does occur, what is your system really telling you? What is it that you are ignoring that you really shouldn't ignore? So let's start with something as easy as tooth pain. What happens if your jaw hurts, if your teeth ache? You could be ignoring something that's quite significant. Did you know that every tooth in your mouth has an organ system and a muscle that it relates to directly? That goes back to old traditional Chinese medicine and years ago. There's nerve roots and there's acupuncture channels that relate to your teeth, that relate to different parts of your body. You can get an infection, and having taken very good care of your teeth, and you wonder, how did that happen? It could be because that organ system is in problematic situation as well. So we have to know what they are. The center teeth, right in through here, they relate to kidneys and organs of gonadal function. The ones in the back, that can be your large intestine, intestinal tract, and lung, and so forth. And there's ways of finding that out. There's ways of appreciating it. All of a sudden, you see the body begin to break down for a lot of different reasons. We're going to tell you a little bit how to take care of your teeth. By the time we get through today, I think you're going to be surprised of the fact that it really has that kind of impact. So don't ignore your teeth. That severe throbbing pain, it could be that you've got a pus-filled sac in there that is really going to break things down at a much greater level. But I'll give you a distinguishing characteristic. It's real simple. If you drink a glass of water and there's ice in it, and your teeth, just shocking pain goes through your system, that's because there's an inflammatory reaction of some sort. If you drink hot water and that hurts, that tells you that you have a deep-seated infection. Now, the combination of the two can occur as well, but one distinguishes the other. So you can have inflammation simply because you have something that's in there that's irritating it. You need to go get your teeth taken care of, get it cleaned up. You could have an inflammatory reaction because you're reacting to something that you're sensitive to, as far as an allergy reaction or something of that nature. You could have a inflammatory reaction because your TMJ is off, and every time that you hit your teeth, you're twisting the ligament around the tooth. It's called the alveolar ligament. So any of those things are possible. So we want to make sure that you understand that there are distinguishing characteristics, and don't let somebody tell you just because you have pain that it's time to remove the tooth or that we're going to watch it. What are you going to watch? We're going to take care of something. You're going to hear that from my mouth all the time. Watching something only progressively makes things worse. You have to find out the why behind it. What happens if you have chest pain? Your chest hurts and, you're saying, I must be having a heart attack. Well, maybe, but there's certain things that you want to stack together. That chest pain, along with maybe left arm and shoulder pain, along with pain in the jaw, along with somebody feel like they're sitting on your chest. That's hard. You better get yourself to the emergency room very, very quickly. Don't put up with that. But slow, insidious buildup of those things as well over a period of time can't be ignored. But that chest pain also could be the big muscle that cuts you in half, the diaphragm. It's not moving the way it's supposed to because you're not breathing properly. It could be because the nerves and the lower part of your neck are being overstretched, or they're being irritated or being pinched in a way that it's causing those muscles not to work, or the muscles in between your ribs not to be able to move and expand properly. So you have to diagnose them. Don't ignore chest pain. Don't think it's, oh, just I'm not breathing properly. Don't ignore chest pain and say, well, it must be something else. Go find out what it is. Check out somebody like me, get a good examination done, particularly if it's been there for any length of period of time. It hasn't killed you yet, but you don't want to have that on your hands as well, right? You have a lot of family that love you a lot, and you want to make sure that everything is cool. What happens if your stomach hurts? Right? You have that burning feeling in your gut. It could be digestive because you're not producing enough hydrochloric acid. It could be digestive simply because of the fact that you're taking acid blockers, and that's not the way to treat that, which you've heard me talk about repetitively over a period of time. It could be that you have an appendix problem. It could be your gallbladder is giving you a problem. It could be your pancreas is problematic. In today's world, what pancreatic insufficiency or endocrine insufficiency, is that what they call it now? That gets cleaned up real quickly if you free up the nerve roots that go to the pancreas, and you balance the acupuncture channels, and you change the dietary patterns so you begin to ease it up and take the load off of it. Those are the critical pieces, and they're really important that you understand that. So how would you know? How would you know, you say, if I have any of those things that are fixable and it's not an oh my God situation? Well, it's really pretty easy. Those of you who are not on acid blockers, but you bloat and you get irritated, it seems that certain things hurt you, try something with your meal. Get yourself some apple cider vinegar and put about 2 tablespoons and a little bit of water. And after you eat, sip on it and drink it and see if that relaxes it and makes it go away. If it does, it tells you that your production of your normal digestive enzymes aren't at the levels that they should be. Interesting, right? So, real simple situation. But when I tell you that if you're on a protein pump inhibitor, that things that stop the acid production in your stomach, don't do this, because any acid that you add to your body at any level will burn like crazy. Why? Because when you drop the acid production down with these protein pump inhibitors, the barrier that protects the muscle, the stomach, from your own production of hydrochloric acid, your normal production of your hydrochloric acid, is not going to be there. And subsequently, guess what? It burns, and I'm telling you, it burns bad. So even with our patients that we want to move forward slowly and repair that, because they've been on these protein pump inhibitors over a period of time, it's a step-by-step, very slow process that will allow them to get their life and their health back and get that to restore itself. There's ways of doing it, but you have to be all in. And we've done it for over 4 decades with hundreds, thousands of patients, and very successfully, and it can be done. So we want you to make sure that you have the tools to make that take place. So your chest pain, your abdominal pain, things like that. What happens if your legs hurt? just general ache. Oh my God, they're so painful. I don't know what to do with them, and they cramp up like crazy. In today's world, because of all the advertising, you think it's peripheral neuropathy. It's possible. But remember the old cliche that I use all the time, that if you hear hoofbeats, look for horses, not zebras, look for the most common things. It's usually not the clot. It's usually not the embolus. It's usually not that thing that's going to give you a stroke. It's often the low levels of calcium and magnesium in your diet that are allowing those muscles to cramp up and tighten up, and they just don't seem to want to go away. So if that's the case, what's an easy way to challenge that to find out? Go to the store, get yourself some magnesium glycinate, take about 200 to 300 milligrams twice during the day. Take a little low level of calcium lactate with it twice a day. What do I mean low level? Maybe 150 milligrams to 200 milligrams. Take it for a couple of days and add some vitamin D to it. Most of you are vitamin D deficient. You're not taking enough. When I tell patients, I want you to take at least 10,000 day in a day, I say, oh my God, my doctor will tell me that it's not too much. Trust me on this one. Take it and see if over 2-3 days those legs don't feel better. That's the way of challenging it. If your legs are swollen and they hurt, different story. Then we got to find out, what's underneath it. Do you know your calf muscles? Those things that, we all like to see nice and firm and not sloppy and hanging. There's two muscles. One is in the bottom, the other one is on the top. The rounded ones we think is the gastrocnemius muscle. But underneath that, there's a muscle called the soleus muscle. The soleus muscle is often known as the second heart. And what it does, it pumps blood back up to the heart, blood that's been used by your body, and it has high levels of carbon dioxide in it. So it goes to the heart, it gets more oxygen, and goes back down. It helps pump it all the way back up. Your heart pushes it down. And by the way, with that diaphragm we just talked about, and that soleus muscle pushes it back up. So if that muscle is not working the way it's supposed to, because the muscle is locked up, it's cramped, it's reacting against its partner called the gastrocnemius, then your feet are going to swell. And if your feet swell in conjunction with your legs hurting, and there may be a transitional color in them, that's the time to get a little worried about it. And you've got to get things squared away. But it's not being stuck on drugs the rest of your life. It's finding out what it could be and fixing the why behind it. If you fix the why behind it, it goes away and you feel a whole lot better very rapidly, very quickly. So really is interesting challenge, right? All you got to do is that, remember, magnesium, a little bit of calcium lactate, and by the way, hydrate. Make sure you're drinking enough water. Put a little Celtic salt in that water and see how your body begins to respond. Chest pain, if it is something that is significant, remember somebody's sitting on your chest, you got pain in that shoulder, goes between your shoulder blades, comes up into the jawline, don't ignore it. Get yourself checked out and do it. I mean, now, immediately, right now. Don't listen to me anymore. Just go to the hospital and get it squared away. That's how serious I am about that way. If it's a generalized problem and it's been there for a while, then the chances are it's not directly related to the heart, although over a period of time it may be. But it's time to get it looked at. You see people like me, or if you want to calm your reaction down, go get it checked out, and then come see us, and then we'll get it squared away, because so much can be done on that level. Remember that these pain patterns are significant. How about a headache? How about a pain pattern in your head that comes on sharp, real fast? You've never had it before, and it's like it locks your eye down and it hurts like crazy. Well, it could be a lot of things. It could be temporomandibular joint dysfunction, TMJ here, this thing. It could be locked up. Why? Because there's a nerve called the trigeminal nerve. That means three nerves. And one goes into the jawline, another one goes into the cheekbone, another one comes up into the forehead like this. And any one of those distributions can cause pain. You could feel pain in your jaw, you could feel pain in your face, you could feel pain in your head. Subsequently, that type of pain is resolvable, but you have to fix the muscle patterns of that temporomandibular joint, or you have to rule out the presence of a virus that might be in there that could be shooting into that area, and the pain could be significant. Now, if you have pain that suddenly shows up and it feels like it's one side of your eye and like somebody's got a stick in it and your eye vision changes, get yourself to get checked out like fast, like now. So there's a distinguishing characteristics. And on the 16th, we're going to go through those. We're going to walk you through different pain patterns and show you what's there, what can happen, what can show up, and what not to ignore. Make sure that you have the tools to make a difference. Because if you ignore it and it's significant, you got a problem. But here's the problem. Here's my problem. Way too often, when we go see good-hearted medical physicians and we're complaining of whatever it is, the response becomes, I don't see anything. There's nothing that we can find. Take this and let's see what happens. Let's see is not a good waiting situation, because if you really don't understand it, then you have to dig until you do understand it and then treat it accordingly. But unfortunately, the medical model is always about doing what? It's about throwing a drug at it or an anti-inflammatory at it or some sort of painkiller at it. And what you're really doing is you're treating the symptom process by really not comprehending, understanding the underlying situation that could be there. When we treat a patient, we're looking for the why is that. We're looking at the situation. Did you know if you come in and you see somebody like me, there's going to be a whole bunch of preliminary examinations that are going to be done before the doctor even talks to you on the same day. And we're going to find out posturally what your blood pressure is. We're going to do your blood pressure sitting. We're going to do it lying down. We're going to do it standing up immediately. We're going to do your pulse oxygenation. We're going to check your oral pH. We're going to see if your mouth is acidic or basic, your tongue, because that gives us expression to the rest of the body. We're going to check an energetic flow in your body. We're going to see your gait pattern. We're going to watch how you walk and how you stand in plumb line, and because all those things can be contributory, correct? And then we're going to do something called a zinc tally test. What that means is that we're going to check your zinc levels out by putting some zinc sulfate in your mouth. And if you don't do it like that, oh my God, it's terrible, then you flunk the test. And because the zinc should taste bad, and if you have enough zinc, then your immune system is fairly decent. So now we have all this data, and then we go in and begin to really pick you apart and find out why the problem is there. You know, the interesting thing is that the patient that takes primary interest in their health and really asks the right questions and doesn't allow the doctor to say, well, let's see what happens with this. I think it might be this, but let's watch it. What are you watching and waiting for? You need to understand it now and take action on it now to be able to resolve anything that takes place. So that's the difference. That's how we look at certain situations. You need to be able to take action now. You can't ignore pain. Body pain that's ignored leaves dead people or leaves severely impaired people. So on the 16th, we're going to get into the differentiation, the sharp pains in the head and pain, in your pelvic area, right? So if that pelvic area, down by your pubic bone, way down, ladies, for you, if you got sharp shooting pain that shows up there, regardless if you're a menstrual cycle or not, that could be finger pointing directly and tell you that something might be going on with the ovaries or the uterus. Guys, same thing, prostate, don't ignore it. These are things, how have you ever had the feeling where, guys, this is for you, that you urinate and it hurts, there's pressure inside of it, then you ignore it long enough, if I ignore it, it'll rust up and go away, and then it goes away, it's better, but then it comes back again. That's telling you that's an issue. It can come from a lot of different things. It can come from a spasm of the tissue itself, the organ, or the bladder, meaning the prostate or the bladder itself. Ladies, for you, you've got the bladder, but you also have the ovaries. You also have, the uterus that are hanging in there. So there are certain types of pain that you don't ignore. Conversely, breast pain. It may be absolutely nothing, and most times it is. It could be the long nerve that we've talked about. The long thoracic nerve starts right here, comes all the way down to this side of the breast tissue. And if that's there, it hurts. It hurts to touch. And it might feel a little congested as well because your lymph system is blocking up, because that helps stimulate that. you don't ignore things like that. You find out what the cause is and you treat it. I would suggest, if you've never had a thermographic examination of the breast tissue, now would be a perfect time to do it. Call Dareth Painter at either through Thermography Centers of Virginia or Thermography Centers of Fairfax, or call our office and set an appointment with her and find out. It's painless. There's no radiation, but it's hugely accurate, and actually it'll show the any problem that is problematic 3 to 8 years before any kind of tumor or lesion shows up in the breast tissue. How great is that, right? So make that call. There's so much you can do. And on the 16th, we're really going to get into a lot of the diagnostic pieces, what you can do, what it really means, but also more importantly, what you can do to fix a lot of these things. What's possible? What you can do to make sure that this pain that you're having, the types of pain that you're dealing with, are not something that you have to say, oh my God, over, right? It's important that you have the tools. And remember, where did I come up with the thing, Ageless Health, Health is a Do-It-Yourself program? It's because the truth of it is that an educated patient, one who asks questions, one who begins to stack information and not just get into a crazy spin over some kind of, oh my God, this epidemic is going crazy, without asking the question, why is it there? How does the body fix it on its own? Is it possible to get it done? And, making sure that you have the tools to take care of yourself. That's why we did it. That's why I wrote my book, Ageless Health, Health is a Do-It-Yourself program. So you have to make sure that you take the time to educate yourself, and don't just put it in somebody else's hands. That's not the way it's done. You have to make sure that you understand, that you are willing to say yes or no. I just came back from a trip. I was in Italy for 8 days, and I spent 3.5 days lecturing to a group of Italian osteopaths. And these guys are really on fire. They got it. There's about 35 of them, and I spoke for 2.5 days, the first time ever with a translator. And we went into talking about the why behind things. These guys want to understand how the body can take care of itself. A little different attitude that we have here. But you know what I noticed is that because of that attitude, and they give it to their patients, there's things that happen there very differently than happens here. Patients are not content to put up with something. Patients are not content to take this medication and say, let's see what happens. A lot of things that are different. The food that they eat is clean. They don't have all the crazy things that we put into our foods. They walk virtually everywhere. Change your life. Reclaim your health. Don't put up with the pain without understanding where it's coming from. But don't put up with pain simply by taking medication. Ask the question why it's there, and then take the steps that you need to take to make a difference. Join me on the 16th. We're going to have some fun. I'm going to show you what pain patterns do to the body, how your body adapts to them, positional things that you get into to adapt to them. We're going to answer any of your questions. I'm going to tell you exactly what steps that you need to take on your own to restore the function. Pain is deadly in so many ways. It's deadly because it takes your life away from you. You don't want to do anything if you're hurt. But what would it be like if you could get out of pain? What could it be like if you were able to help yourself do better all the time? I don't know about you, but that's where I'd like to go. I'd like to make my life better. I'd like to turn things around. And that's what we're going to help you do on the 16th. So join me then, okay? Bring your questions. We're going to talk a little bit more as we go into the program in about a week. But having said that, remember, my whole purpose is to give you as much information and to help provoke freedom of medical choice and put it in your hands, not in the traditional medical committee, not in the political arena, not in the hands of the drug companies. but in your hands. So you know what to do to help yourself and optimize your presence on this planet. Remember one thing. I love you all. I'll see you next time. Bye.